A lot of my patients come in saying, I want to get my hormones tested, I heard from Dr. Oz or Oprah, it's all in the news, I need to know what's going on with my hormones, I don't feel well. And they don't really understand what hormones mean, or if they've already had some hormone testing done, what hormone testing has been done and what can be done. So when we talk about hormones, they're signalers in the body. So that's one way that your organs can communicate with each other, is through hormones. One organ will send out a hormone to signal other things in your body to happen, and then there's a feedback loop. So I like to talk about the three big major organs when we talk about hormone balance. So you have your adrenals, which sit right on top of your kidneys, and those are the stress gland. It's the gland that produces cortisol, so your fight or flight instinct comes from the adrenals. And then we have the thyroid, which is in your neck, and it produces thyroid hormone, and that kind of governs metabolism, your body temperature, whether you put on weight, some of your digestive tract, if it's too fast or too slow. And then we have our sex hormones. And so if you're a male, that's primarily testosterone, and if you're a female, that's going to be primarily estrogen and progesterone, depending on what time of the month you're in. And so those three form a nice little pyramid. At the bottom, you have your adrenals. That's the foundation. That's the thing that keeps you alive. That's the thing that keeps you running away from a bear, or when you get cut off in traffic, that's the thing that keeps you safe, slamming on your brakes. The next thing is your thyroid. Those hormones, like I said, have to do with your metabolism, and if you burn energy or if you store energy. If there's famine going on, you want to store all of your resources, everything you eat you want to store so that you have that for later on. And then your sex hormones, obviously all the fun things in life, as well as being able to reproduce. And so you have a nice little pyramid, and generally when your body is under stress, and when I say stress, I don't mean pull my hair out, I'm so upset stress. Stress can be anything that your body perceives as not good. So stress is your job. Stress is not sleeping enough. Stress is eating foods that inflame your GI or aren't good for you, that cause this inflammation in your body. Stress can be anything that your body perceives as a threat or something that is going to impact your ability to live. And when your body is under attack, what it does is it tries to keep you alive. It's doing exactly what it's supposed to do. And so if your body thinks you're under attack and there's famine or war, it doesn't know the difference between running away from a bear and your boss coming in and yelling at you. It just knows that there's something not right going on. And so what happens is generally the first thing to go are those sex hormones. Those get off balance because your body is using all of its resources to make sure that you stay alive, that your cortisol is making sure your blood pressure stays up so that you get blood to your brain so that you don't pass out. And so as we get more and more stressed, and there are more and more things in our environment that don't sit well with us and aren't healthy for us, then slowly your body starts interfering with your sex hormones, your thyroid hormones, and your adrenals. And so when we talk about testing hormones, we're talking about all of those. So a lot of people will have their thyroid hormones tested, but that's just one piece of the puzzle. And having your sex hormones tested is one piece of the puzzle. So here at Pure Vitality Rejuvenation Center, we have the ability to test all three of them. So when you come in and you have an appointment with us, what we'll do is see what symptoms you're having and what's going on in your life, and we'll determine what needs to be tested, and based on your levels, we have a comprehensive, unique treatment plan just for you.